one is expecting a baby, it's a very wonderful thing. It comes with joy, it comes with shock, it comes with how to respond to it. It's a very wonderful thing. However, if you are pregnant breastfeeding, and maybe say the baby is around 3 months to 6 months or 8 or 9, and you are told that you are pregnant again, there's a study that indicates that women that do exclusive breastfeeding have the opportunity to practice natural contraceptive from breastfeeding. This is because when you are breastfeeding, the hormone that is being produced is prolactin. Okay? And because of the prolactin, it prevents ovulation. And because it prevents ovulation, you cannot get pregnant. However, it does not work for everybody. Okay? Some women still get pregnant even though they are breastfeeding. And now the question is, what will you do in case you realize that you are pregnant? Why? Breastfeeding. How does all this information, you're pregnant while breastfeeding, how do you manage the pregnancy? How do you manage the baby that you're breastfeeding? And how do you make do with the pregnancy and the symptoms of pregnancy? We have what? Number one, while you are pregnant, the most important thing you need to take in consideration is what? We have calories. We understand that when we were dealing on carbohydrates, we said that the amount of calories that is needed per individual depends on their states, depends on their weight, depends on their activities, and depends on generally how far or how much activities that individual does per day. And now when we are thinking about a breastfeeding mother, when we are thinking about a pregnant woman, when we are thinking about an infant, when we are thinking about an adult or somebody that is actually like a truck pusher, what do you take into consideration and the quantities of calories that the individual has to take? Now come to realization of this. This woman, we already have like a lady, what is the percentage of calories that she has to take for herself? So we have her as an individual. Number two, we have the child. Number two, we have the child. And number three, we have the what? So she must, or you must be able to tell the woman that she needs to take enough or sufficient amount of calories that will accommodate these three individuals. Herself, the child that she is. Now, when we talk about if it is safe, we already know that it is very safe for a woman who is pregnant to breastfeed another baby. And it is safe right up to the moment that the woman puts to bed and the two babies can actually breastfeed together. That form, they call it what? Tandem nursing. This is a situation whereby you breastfeed two babies of different age at the same time. Yes. You can actually breastfeed. Don't squeeze your face, okay? You can actually breastfeed the baby right up to the level where you put to bed and you breastfeed the elder sister and the junior sister, or the elder sister and the junior brother at the same time. Yes, it's possible to breastfeed a child that is not yours. There is nothing wrong with that. But now this will surely be in a situation whereby the mother passed away. Okay? If my sister is pregnant and she died during childbirth and I am breastfeeding, I can take that baby and breastfeed that baby. How will you even have breast milk if you are not breastfeeding? You will flatter the baby by giving your breast milk. Don't do that.
When the child starts sucking, that's when they will start coming.
No, don't get that kind of intention. It doesn't work that way, okay? When you are pregnant, okay? When you are pregnant, there are hormonal changes that take place until when you deliver. The breast milk does not just come out. So do you tell me that the husband had been sucking the wife's breast for as long as possible? The breast milk coming out. Is the breast coming out? Or you don't know? Alright, we already know that it's safe to breastfeed while still pregnant, right up to the moment where you deliver. And you can actually breastfeed the two children at the same time until you start trying to wean the first baby off breast milk. However, it is always very difficult to wean the first child off breast milk if you took the breastfeeding right up to that point. So I always advise mothers, if the older child gets to 6 or 9 months, between 6 and 9 months, and you are still pregnant, it is good you wean the first child of breast milk before you start, before you go to delivering the second baby. And you think that you are a full-time mom and you have the time to give to the two children, you can take them and breastfeed them at the same time. Is it okay? So you do not get on internship and they ask you what is tandem nursing, you say you don't know, you have never heard of it. This is what? Breastfeeding two children of different ages at the same time. And we go now to talk about, will the pregnancy affect the milk, which has been one of the problems that, according to the belief that we Africa have, they say the pregnancy will affect the milk. Now, for one, will the pregnancy poison the milk? No. Alright? The pregnancy, because they say the heat of the pregnancy will poison the milk. The pregnancy will not poison the milk. And yes, while you are pregnant, there are different hormones that are contraindicated to the breastfeeding. However, these hormones are safe and you will not harm the baby in any way. Okay? It will not harm the breastfeeding baby in any way. And number two, it will affect the quantity of breast milk that is being produced. The pregnancy, because of other hormones that are coming into play, it will reduce the quantity of breast milk. That is for sure. However, the mother can easily boost her system to be able to produce enough breast milk for the breastfeeding baby. Now, we are talking about what? The amount of calories that she has to take. She has to take sufficient amount of calories that is meant for 3 individuals. That is number one. She has to take a lot of water to be able to balance every other thing, what she's sending out and what she is feeding the baby. That is number two. Number three, you have to encourage the mother to do what? To take her minerals, to take her iron, to take calcium, all the other minerals that she's supposed to take for ANC, she must take them and she must take them correctly. Is that understood? So, in the long share, what am I saying? If a woman gets pregnant while she is still breastfeeding, it is completely safe to ask her to continue breastfeeding until the moment she delivers and breastfeed the two babies at the same time. However, if her pregnancy is not safe, if her pregnancy is a type that she cannot eat correctly, she vomits as much as a woman that is having multiple pregnancies, please, it is advisable to tell the woman to stop breastfeeding and concentrate on herself and the pregnancy, as well as to see how she can give a balanced but safe meals to the new baby. Is that understood? Any questions?
Yes, can you breastfeed a child to the child at least 1 year?
You can breastfeed a child up to 2 years. Any other question?
Begin the workout, you catch
Any other question?
They used to say that when you put to birth, you cannot get pregnant. You cannot get pregnant like immediately because your placenta or the womb is not yet healed fully.
How long does it take for the womb to get healed? For a woman who delivers through cesarean section, it takes her just 6 months to be completely healed. They always say wait until 2 years before you deliver again. But I tell you that from 6 months to 2 years is the same healing stage. She's healed already. Okay? So the time period is just to give her to regain herself and to be able to take care of the baby before she goes in. Because she might still go in and still deliver through cesarean section. But for a woman who has a normal delivery, it will take her just 2 to 3 weeks. Okay? And she'll be fine. But they will say that you cannot get pregnant because of the high production of prolactin, which is the hormone that causes what? The secretion of breast milk, which prevents estrogen that will eliminate ovulation. So the systematic changes that take place in a woman.